Welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we are discussing about QMB plan in our medical billing. QMB stands for Qualified Medicare Beneficiary. Today we are discussing what is QMB and who are eligible for QMB plan and uh, and also what are the income and asset limit to eligible for the QMB plan, and if you are eligible how you can apply for QMB plan. And also, for example, you are working as a AR caller, and if insurance is denied stating non-covered services and a patient have a QMB plan, then what kind of action you would like to take? Can you bill patient claim medical claim to patient or not if the patient have a QMB plan? And what kind of points to be noted for this QMB uh, individuals? And for example, there are a few kind of uh, people are eligible for QMB. Even there are so many people are living under the economical ladder, nothing but under the poverty level. So those all people are eligible for QMB plan, or there are some kind of criteria should be there to apply for QMB. So we have to understand that before we would like to discuss about QMB plan. There are a other plans also available in a respective government of state of that particular country. So there are a other plans like SLMB, specified low income Medicare beneficiary plan also there. So, and also there are a disabled people also available. For that disabled people also there are some kind of programs are there. So these are the QMB plans are nothing but some government helping programs. These programs are given by the respective states, and they are also following the federal rules also, but these are provided by the state funded government programs. So these are provided by the state government and also followed by the government, I mean federal rules also, but mostly to help the people of a respective state of individual who are living under the economical ladder. So there are a criteria we will discuss in this video, guys. Before that, if you are watching our video first time, if you're not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth, and hit the bell icon so that you will get every our video as a notifications to your mobile. Guys, here QMB, Qualified Medicare Beneficiary, is a Medicare savings program in the United States designed to help eligible individuals with a low income and resources. See guys, this is a uh, associated program type, means the respective state of that particular individual who are living under the economical ladder, nothing but the poor person who is living under that particular state government is helping to that particular individual to pay the premiums of Medicare, traditional Medicare, because they are very poor. They are not even able to pay the premiums of that particular traditional Medicare of federal Medicare. So to pay the premiums of that particular federal Medicare premiums, the respective state program is helping to that people. So that is why it is called as a Medicare savings program. So generally the state Medicaid is helping in the form of program, like it is a QMB program, to pay the premiums to the traditional Medicare. So that is why it is called as a Medicare saving programs. And also not only they are paying for premiums of Medicare Part A, Part B, and also this QMB program is helping to that particular individual who are under the economical ladder for a deductible coinsurance and copays also. So that is why here completely the Medicare premiums and also Medicare cost shares are paid by the respective programs of that particular state. That is why it is called as a Medicare saving program and also QMB plan. Who are the individual who is qualified for a QMB plan, so that person will be get help from the that particular state program. Okay, guys, here the QMB pays for Medicare Part A premiums, hospitals and insurance, Medicare Part B premiums, medical insurances, and Medicare cost share nothing but deductibles, co-insurance and co-pays. So whatever the Medicare paid and applied patient responsibility, that Medicare cost share also covered by the QMB plan. So for example, you are living under the poverty level, for example you are eligible for QMB, then your state government program will pay for premium of Medicare. You are no need to pay also. So your state government is helping you to pay the premiums of a Medicare Part A, Part B, and also deductible co-insurance copay also. So that is what we have to understand, that if you are eligible for QMB plan, it's very really happy. But the unfortunately you are living under the economical ladder and you are qualified for QMB plan. So that is why fortunately the program will helping you to to pay the premiums of Medicare uh, part part A, part B, and also deductibles and also co-insurances. So in essence, QMB acts as a Medicare financial assistance. Yes. So the people who are unable to pay the premiums to the traditional Medicare, to help them, the respective individual of that particular state government is helping to pay the premiums to the that particular Medicare. So that's why it is also called as a Medicare financial assistance program. Okay, guys, now we are discussing about who qualify for QMB plan. To be eligible for QMB plan, you must be enrolled in a Medicare Part A. So if you want to eligible for the respective state of QMB plan, you should be eligible and enrolled for a Medicare Part A. And here the second point, we all of you know that Medicare Part A will cover for hospital claims or hospital insurance. And the second point is, you have a limited income and resources. So your income should be limited and your resources also should be limited. For example, you are living in a particular state but you have a high income, then you are not eligible for QMB plan. Your income should be limited. How much limit we will discuss now. And also your resources also. But for example, you are living in a particular state, you have a very high resources, so you are good with your resources, then also you are not eligible for QMB plan. So there is a limited income and resources individuals are only eligible for QMB plan. So here the monthly income limit for year of 2025 for QMB plan for individual is $1,275 even. And for couple of people, the monthly income limit of 2025 year is $1,724 even. You can get these details even in Google also. So this will be changes uh, from state to state. In United States it will be uh, the income limit and resources limit will be slightly, they will changes from state to state, we have to understand. And also yearly this will be changes, yearly also this dollar limits will be changes. And the asset limit, uh, asset are nothing but resource limit in the year of 2025 for the individual is $9,430 even. And for the couple of people it is a $14,130 even. And here the third point is, to eligible for QMB plan, you should be a US United States citizen person, or you meet immigration of a requirements for a United States. So these are the 3 points. The people who having eligible for these 3 points, those only are eligible for a QMB plan. Okay, guys, how to apply for QMB plan? Okay, you are eligible for QMB plan of that particular state as an individual, and also you are living under the economical ladder. Nothing but you have a limited income and resources. You are under a poverty level. Then how can you apply for QMB plan? There are three ways. mostly you can apply through your respective state Medicaid office. Since it's a Medicaid administrated program, you can directly apply through state Medicaid office. And the second way of approach is you can also get help applying via state health insurance assistance programs, and also you can also get help applying via social security administration department. By these three way of methods you can apply for your QMB plan of that particular state of as an individual. Okay guys, now we are discussing about what are the QMB plan benefits. So you are eligible for QMB. Okay, good. You are applied for QMB plan. Now you should have to understand, right, what are the benefits you will get. So just now I think we covered at the first slide, you don't have to pay Medicare Part A, Part B premiums because your state government of program, nothing but your assisted program or government program or funded program, nothing but your QMB plan will be pay your Medicare Part A and Part B premiums. And also Medicare providers cannot bill for the services covered under a Medicare Part A and Part B. Means, for example, Medicare Part A, Part B premiums they are paying, and also Medicare applied some deductibles, copays, and co-insurances also sometimes, because at at the time those services also covered by a that particular QMB plan. No need to pay your out of pocket maximum amounts also. No need to give any amount from your pocket for your Medicaid services, that you have to understand. And also you may also qualify for extra help with Medicare Part D. Medicare Part D is nothing but prescription drug cost, pharmacy related thing also covered for a QMB plan. You have to note this point also. Okay guys, here you are working as a AR caller, and you are submitted medical claim to insurance on behalf of your provider, or nothing but you are a provider, you are submitted a medical claim to insurance, for example secondary insurance, the state Medicaid of Indiana, for example, or Tennessee. So you are submitted Medicaid claim, and primary insurance Medicare, traditional Medicare already paid, they applied co-insurances PR2 or PR3, and they are cross over the claim to secondary insurance state Medicaid. Now the state Medicaid is denied the claim stating non-covered services because patient has a QMB plan. At the time what you will do, you can bill that claim as a patient, you can bill that claim to patient as a non-covered services, or what kind of action you will take. See, I would like to explain that scenario. For example, patient is eligible for both Medicare and Medicaid, also eligible for QMB program based plan. So here patient has a QMB plan. As a AR representative, here the state question, can you bill medical claim to patient or not for a PR1, PR2, PR3. PR1 is deductible, PR2 is co-insurance, PR3 is copay. So generally here the secondary insurance of that particular, for example, uh, Medicaid of Tennessee denied the claim stating non-covered because patient has a QMB plan. Then as a AR caller, your action on this claim is you can go for adjust your claim, because if the patient has a QMB plan means he is already very low income guy, is as a limited person, and is completely eligible for both Medicare and Medicaid, completely is a qualified Medicare beneficiary. So nothing but here we have to keep understand that the patient is very poor stage, poor person, so we are not able to bill to patient for even small copay also, co-insurance also. Then how we can resolve this claim means you can go for adjust your claim. So because patient has a QMB plan, qualified Medicare beneficiary, so strictly there is a no need to bill to patient for a QMB plans. We have to note this point as a AR caller. Okay guys, here points to be noted. Doctors or providers are not allowed to bill QMB beneficiary for Medicare covered services. So as we discussed, the Medicare premiums and also cost shares are covered by QMB plan. So the providers are not supposed to bill those claims to patient. And also this is for the people who are eligible for QMB. Always carry proof of QMB status to avoid being incorrectly billed. For example, doctor billed your claim, at the time you have to carry your QMB status to avoid such a kind of incorrectly billed claims. And third point, income and resource limits may vary, may changes from state to state slightly. You have to understand income and resources, limited income and resources limits are there, right? That will be changes state to state and also yearly also. And here what kind of resource counted, generally we will discuss what kind of resource counted means. For example, you have a money in your saving account, and for example you are a good at stock market, and you are holding some kind of shares of particular companies in your brokerage accounts. And also for example you are already having systematic investment plans in your mutual funds, and you have a lump sum amounts in your mutual funds. So those people resources are counted. For example, you have a excess amount more than whatever limited amount of that particular state of QMB program, then you are also not eligible, because you have a sufficient amount in your stock market and mutual funds and also in your bank accounts as a savings or checking accounts. So that is why you are not eligible. So but there is a limit to that also. So keep in the mind that resources counted for this kind of things for QMB plan. Some resources are even you have also that will be not counted. For example, your primary home, residence, your primary car, and your basic furniture in your house, and some other personal items in your house, that also not counted as a resources. Keep in the mind. So these are the points to be noted for a QMB plan. Guys, if you felt content is useful, could you please like our video so that it will reach us many more needy people who are looking this kind of content. And if you have any feedback or suggestions, or if you want some clarification, could you please do a comment so that I would like to reply back you accordingly, so that everyone should be on the same page at the learning platform. So again guys, thank you so much for your time. Thank you for watching. Have a good health. Bye for now.